Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
There are many forces in society that are focusing on the very fiber of the dental profession, namely the conduct of each and every dentist who delivers dental services to the public. Here to discuss some of the problems that confront dentistry today is Dr. Robert Doerr, Associate Dean at the University of Michigan School of Dentistry and President-elect of the Michigan Dental Association. Dr. Doerr, the American Dental Association has identified three unfailing characteristics of a profession. These include the primary duty of service to the public, education beyond the usual level, and the responsibility for self-government. How is dentistry done in upholding those three unfailing characteristics?
I think in general, Dr. Chasteen, dentistry's done very well. It's when you begin to look at the individual level of practice that there are some exceptions. But in general, certainly the quality of care provided the people of the United States is extremely high. Certainly when compared to the quality and level of care offered to people in any other country, we rank very well. Unfortunately, there are some members of the profession, and I really believe that it's very few, who don't put service or the welfare of the public or their individual patients first, and they put themselves first. And as in many instances in our society, I guess, it takes only a few bad apples, so to speak, to give the profession an unfavorable image. As far as education beyond the usual level, I think that the extreme interest in continuing education is testimony to the fact that we're doing a good job in that area. There are many, many providers and sponsors of continuing education courses throughout the United States, and all of them seem to be busy. Again, there are some exceptions. We have some dentists who have never participated in a continuing education course since they graduated from school and are still practicing the techniques and procedures that they learned 15 or 20 or even more years ago. As far as the responsibility for self-government, I think that that perhaps is our weakest area, and it's the most difficult of the areas, because self-governance doesn't come easily. We're taught from childhood not to be tattletales, not to, in effect, tattle on someone else, on your peer. And of course, self-governance depends upon what we refer professionally as peer review. And it's extremely difficult, and I think that subject can bear probably further scrutinization.
And indeed, it seems that the public is doing that in the form of consumer interest groups and federal agencies that are now calling for things such as peer review and mandatory continuing education. The public seems to be really concerned about this at this point. How do you account for this?
Well, I think that it partially, Tom, is the result of this age of consumerism that we find ourselves in. As those of us who are in dentistry know, only about 50% of the American people see a dentist with any regularity at all. And so the majority of the people, I would say, really have little concern in this area. But consumer advocates and people who are really more concerned about these kinds of affairs believe that the profession hasn't been doing as good a job in peer review, that the profession has been more self-serving, and that in fact the code of ethics, the principles of ethics that supposedly govern the professional conduct of dentists has been contrived to protect the dentist and not protect the public. So peer review is something that the profession is paying more attention to. It has developed somewhat as an offshoot of the third-party payment mechanisms. Purchasers of dental care wanting to be assured that they're receiving an honest dollar's worth of care for a dollar expended.
Excuse me, Dr. Doerr, aren't we really talking about the dental profession reacting to pressures from the public in these matters rather than taking the lead to establish the support for these unfailing characteristics that we've been talking about here? It seems like dentistry is reacting by, there's public pressure, and then we're coming forth with some mechanism to react to meet that pressure.
I think that is not an unfair accusation, because I believe that we have reacted in some instances. It may, however, just be a sharpening of the focus. Our attention may be more acutely on the problems that are related to peer review than they have been in the past. And I think it probably is somewhat due to the fact that with the advent of prepaid dental care, there are more people availing themselves of dental care, and we have third parties and now even fourth parties who are looking intently over the shoulders of the collective profession and raising some questions that I think need to be answered.
So we're being watched.
Yes, we are.
This pressure for lower cost dental service seems to be mounting as well. You mentioned that 50% of the people don't even see a dentist on a regular basis. Is that group, are they a disenfranchised group? Are they someone that should be provided care for by the dental profession?
Well, yes. You know, the object of the organized profession is to extend dental care to everyone, and as we know, in excess of 99% of the people have dental disease. The fact that all of them don't avail themselves of care is a very complicated sociological phenomenon. As we have removed the economic barriers to care, everyone still doesn't take advantage. But our goal certainly is to extend care to everyone, and I think that the ADA's Access program is testimony to that, where they have identified groups who have been precluded from care, such as the elderly, the handicapped, the poor, the working poor, population groups that have not had the access to dental care that they should have had.
Is this the origin of the denturism issue then that's facing dentistry today? People wanting low-cost denture service? Is that born out of that?
I suppose that it could be in part. I think that that, again, primarily is an economic issue. We have millions of edentulous people in the United States who want care, and many of them feel that the cost of denture service in the private office has been beyond them. And so when someone comes along, whether qualified or not, and offers this service at a reduced fee, it is popularly accepted. They don't understand the ramifications, however, and I think that dentistry has responded well to this particular problem by educating the public, pointing out to the public that indeed in a regular dental office they can provide, they can find different levels of care.
The American Dental Association has drafted a document called the Principles of Ethics and Code of Professional Conduct that emphasizes these unfailing characteristics of the dental profession. I'd like to discuss this document in some detail after this timely thought. Dr. Doerr, what is the purpose behind the American Dental Association's Code of Ethical Behavior?
I think the purpose is to provide standards of conduct to not only control, but to provide examples for the behavior of the professional, the dentist in this case. The ethics of the profession, of course, has evolved over a long period of time and actually developed, I think, in the context in which we're discussing them some 50 or 60 years ago, when ethical practitioners realized that there needed to be some code or standard of conduct to protect the welfare of the public, because there were charlatans and quacks in those days who were taking advantage of the public trust. And so in addition to the laws that legislatures developed to define legally the practice of dentistry, the profession developed this code or standards of conduct that were derived from moral precepts and which were intended to govern the practice of dentistry from this standpoint of moral or professional persuasion.
Does that code address such issues as mandatory continuing education?
Yes, it does. It indicates that dentists are obligated to continuing their education, that this is, as we've said already, one of the hallmarks of a profession. This whole area of continuing education is one that is of great interest today. A number of states have developed mandatory continuing education requirements. And this fact has caused a lot of debate and controversy within the profession, because I think dentists realize that no amount of continuing education will guarantee the ethical practice of dentistry or even the competent practice of dentistry. In other words, a person can take 1,000 hours of continuing education and still be a culprit when it comes to his personal relations with patients.
On the other hand, the public seems to be comforted by the fact that a dentist is required to maintain their knowledge or be a lifelong student by virtue of the fact that some laws are requiring dentists to do that for relicensure.
Yes, and I think we simply have to distinguish between the fact that it is a dentist's ethical obligation to remain abreast of current concepts, techniques, procedures, treatment methods, but we shouldn't confuse that by believing that continuing education guarantees the competent practice of dentistry. These are two different things.
I'm interested in why dental associations, such as the Michigan Dental Association, wouldn't have some requirement for membership for mandatory continuing education, if it would be a good public relations gesture at the very least.
Well, actually, this is something that has been discussed in considerable detail for the past couple years, and I think within this next calendar year, we will see a mandatory continuing education requirement in the state of Michigan. But again, the controversy has been regarding the competency of practice. I mean, the profession wants everyone to realize that no amount of continuing education will guarantee that an individual will be an ethical or competent practitioner. And they feel that peer review is really the professional answer to the problem of competency in ethical practice.
So the code really speaks to peer review as well then, too?
Yes, it does. It indicates that it's a dentist's obligation to call to attention of proper authorities and other members of the profession instances of incompetent practice where patients are being abused. It is stated as an obligatory responsibility. So it's stated in very strong terms. Again, as we said in the early part of the program, this is a difficult thing to achieve. And I think as the students here in school realize, it is a difficult responsibility because it's very analogous to the honor system that the students conduct here in the School of Dentistry. And they know of the difficulty of exposing a dishonest member of their class. Again, I believe that the concept is one that is most important, and it shouldn't be looked upon as a police action. It should be looked upon as a responsibility to gain the ultimate in service or protection of the welfare of the public. The first time that a dentist makes an error, someone certainly shouldn't be blowing the whistle on him or her. It is a question of continued incompetency, just as a violation of the honor system here. If someone thinks that his peer is looking at someone else's paper, it isn't their obligation to turn that individual into the honor council. It is their obligation to go to that individual and tap the student on the shoulder and tell them that they have placed themselves in a suspicious circumstance, and please refrain from that kind of activity again. And the same is true in practice. The first time that a dentist sees an amalgam restoration placed by another dentist and it has an overhang doesn't mean that that dentist habitually provides incompetent care to his or her patients. But if a dentist routinely and over a period of time sees incompetent care emanating from an office, then it is the responsibility of the individual to first contact that individual, ask him out for lunch, and sit down with him and talk to him about the things that you are seeing that you don't believe constitute good care. And then if the individual is unwilling to change his or her ways, then the individual is cited to the local ethics committee.
I'm wondering if we can return to the document just for clarification purposes for a moment. The document seems to identify principles and a code. Could you
Yes.
distinguish the difference between those two areas?
That distinction was made by the 1979 House of Delegates of the American Dental Association. The principles are intended to be the goals toward which every professional strives. The code is the enforceable portion of the document. In other words, you will find in reading the document that there are principles followed by codes or interpretations of those principles, and the codes are enforceable and are intended to be enforceable.
Several years ago, states took that basic ADA document and then amended it in some way or added to it in some way for further clarification. Does that still exist?
Yes, it exists in all areas but advertising. The agreement that the American Dental Association reached with the Federal Trade Commission in the area of advertising indicates that the ADA principles and code are the statements regarding advertising for every constituent and component dental society. But in other areas, it still remains true that constituent or state societies and component or district or local dental societies can add to the principles and code. They can make it more restrictive, they can never make it more lenient.
If a dentist is in violation of one of these codes, what's the mechanism of enforcement?
Well, there are three primary levels of enforcement. The first is simply one of censure or of citing the individual. If it is sufficiently serious, the individual's name can be publicized in the local bulletin or newsletter or in a state society journal. Beyond censure is suspension of membership for a stated period of time. And then the third level, and the most serious obviously, is expulsion from membership in organized dentistry. Now this doesn't cover, of course, the non-member. The practicing dentist who is not a member of organized dentistry and incidentally The principles and code indicate that it is part of a dentist's professional responsibility to be a member of organized dentistry, to participate in the governance of the profession and its other responsibilities. But there are some dentists who are non-members, and if a non-member dentist is found in violation of the ethical code, that individual is referred, or the situation, the problem is referred to the State Board of Dentistry.
In terms of this violation, and someone is found guilty of the violation, and you mentioned the consequences, what does that mean to the truly shoddy dentist, to have membership suspended even from the American Dental Association? In reality, what is that, how does that impact on that individual?
Well, first of all, I think there's the social pressure, and I believe that that's an aspect of peer pressure. I think it would take a very hardened individual not to be affected by expulsion from organized dentistry, and have his or her peers know that he or she has been expelled from membership in the organized profession. In a practical sense, of course, it means that the individual can no longer participate in all of the benefits offered by organized dentistry, ranging from its very comprehensive insurance programs to its scientific continuing education opportunities, to the various services offered by the various bureaus, divisions, and departments of the American Dental Association. And there are many of them, and these are, of course, listed elsewhere, but we could spend an entire program talking about the benefits of membership in organized dentistry.
So it is a significant loss to the
Yes,
individual.
it is.
Are many people cited for violations each year?
Yes, of course, that depends on the size of the society. I can remember a number of years ago when the chairman of the ethics committee in the Detroit district used to come out and talk to the students. And Dr. Silverman indicated that the Detroit ethics committee was handling from 15 to 30 cases a month. Now, most of these would fall in the area of patient grievances and not true ethical violations. But it would require the ethics committee to be the adjudicators in fee disputes primarily. There are relatively few serious ethical violations, but there are a great many patient complaints.
Of those violations that you are aware of, what is the typical nature of those violations? What kinds of things become troublesome?
Well, I indicated that most of them are over fees.
I mean, I'm talking about the truly, ethical problems.
Oh, the ethical problems?
Yes.
I think that today the ethical problems come from misrepresentation and from discounting practices in relation to third parties. Primarily the area of misrepresentation. There are a few cases of truly incompetent practice where individuals are asked not only to refund fees for the service that they provided, but are required to participate in continuing education programs and prove that they are competent from a technical sense to continue the practice of dentistry. Many of these cases, of course, also involve legal problems, and they're pursued at the civil level.
I'd like to just focus on that for a moment. We've talked about the law and the code of ethics. Why do we have a code in addition to the law?
The code goes beyond the law. The law, or the body of law referred to as jurisprudence, just defines in a legal sense the practice of dentistry. But as we indicated, the principles or code of ethics stem from moral precepts that go far beyond the laws governing dentistry. They actually relate to the individual. So they are, in almost all cases, more prohibitive, more restrictive than the law itself.
Isn't there also then a third level even beyond the code, and that is the personal ethical conduct of an individual?
Certainly, and this is extremely important. If we had a measure of these personal attributes regarding integrity, honesty, the other intangible non-ability factors to guide us in our admissions programs, this would be marvelous, but we don't. But of course, the code by which we conduct our daily lives certainly impacts on this whole area of discussion.
Thinking of the student that is about to graduate and enter into a new world, a new environment of dental practice, do you have any concerns that you could share with us about the fate of that student relative to the items that we've been covering today?
Well, I have some very deep concerns because of the pressures that our young graduates find themselves under, many of them economic. And I think all of us who are associated and have been associated with the profession for any length of time recognize that it is extremely difficult to put service first where it belongs. But also, in looking at the years that I've been associated with dentistry, I'm confident, just very, very confident, that those dentists who put service, the welfare of their patients first, who treat their patients with kindness and charity, don't have to worry about personal reward or personal security. This is difficult to do in the face of $50,000, $60,000, $100,000 of indebtedness. On the other hand, I believe that our graduates have to understand that they are entering a lifetime career and that a few years spent in developing the kind of practice with which they're going to be comfortable over this professional lifetime are years indeed well spent.
Do you think that the student coming out of school has the notion that here I am world, just come flowing into my practice, and that they can establish a debt that is considerable because they'll have ample resources to pay for it and find themselves in trouble? Is that a typical scenario, or?
Well, it certainly is a scenario. I don't know how typical it is, but there are certainly young dentists who find themselves in this position. And today, in economically depressed times, there are too many of them that find themselves in this position. Certainly the elements of practice administration that deal with the proper methods of establishing a practice should be heeded. I think that unfortunately today, and this maybe goes beyond the confines of our discussion of ethics, but I think that there are too many of our graduates who feel that they have to start out with a Cadillac in the driveway in a figurative sense, instead of beginning their practices more modestly and letting their practices grow with them as their skills increase. From an ethical standpoint, I think that there must be a realization at the time of graduation that the dentist is not a finished product, that he or she is going to continue to grow for a significant number of years, and this is why the professional obligation of continuing education. But the dentist on graduation can't be all things to all people, and that probably never is going to happen in a legitimate definition of the word, but certainly they're going to become more comfortable as their skills grow, and 6 or 7 or 8 years out in practice They're going to look at some of the problems that they have encountered in their first year or two and think of them with a smile.
Dr. Doerr, thank you for sharing your thoughts with us. Our guest has been Dr. Robert Doerr, Associate Dean of the University of Michigan School of Dentistry and President-elect of the Michigan Dental Association.
Join us for other programs in the By-Design series that keep you abreast of current topics and trends in the management of a modern dental practice.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.